everyone, I'm Dr. Anna Marie. Today we're discussing a medical breakthrough to treat misaligned and flat feet. We'd like to welcome a world-renowned foot and ankle expert to the show to talk about this revolutionary orthopedic solution. Dr. Michael E. Graham, thank you so much for joining us. What an honor to have you here.
It's my pleasure. Thank you so much.
Before we get to the procedure, let's back up a little bit and talk about misaligned feet and how this could open a whole can of worms when it comes to the overall health of somebody's body.
Exactly. You know, our feet are the most neglected and abused part of our body. We put our shoes and socks on and forget about them. But misaligned feet, starting in young children, will only get worse as we get older because walking is the second most common conscious function of our body. We take thousands of steps a day. So we worry about the alignment of our buildings and of our cars. But when it comes to our body, which is so important, we just shrug it off. And so basically what happens is that the ankle bone loses its normal stability, and that's what causes misaligned feet. And then that sends off a negative chain reactions to affect the knees, hips, and back.
You know, there's been studies out there that basically that in a sense of even like getting back to the children, when they see their doctors, they'll just say, oh, they'll eventually grow out of it. I mean, what are your thoughts in regards to that advice?
Exactly. I mean, the whole thing is that there's no evidence for that. You know, there was a paper that came out that basically looked at the fat pad of the inner arch, and it's true that babies have kind of fatty feet, but you're not supposed to have a flat foot. And so there's no evidence anywhere that how these kids, you know, how the bones that were misaligned all of a sudden become aligned. And what's even worse is all the other medical problems that can happen because of those misaligned feet. And pediatric obesity is such a big problem, and even adult obesity is a problem. And you know, the number one recommendation is just to simply go out and walk and exercise. But when you're punished for doing that with pain to all over, you're not going to exercise. So then what happens is your metabolism decreases, you gain weight, and then the more weight you have, then you have all these other medical problems, like of course obesity, but then diabetes, hypertension, and heart disease. And it seems like, you know, nobody's ever cured of these other diseases. We just kind of treat those symptoms with pills and medicines and things like that. And you know, again, we want to get people out walking and exercising. That's kind of like the big missing piece to the puzzle.
You know, this is a topic very near and dear to my heart because I'm a podiatrist, and the fact of the matter is it really amazes me that a lot of people are just kind of like, oh my gosh, I feel so much better. My knees are better, my hips are better, my back feels better when you get that foot supportive.
Exactly. Right. Definitely.
So tell us about this procedure. Obviously, you know, you're the brains behind the invention.
Right.
Could you simply explain to folks how it works?
Yeah, okay, so again, the whole thing that we're trying to fix is really one thing, and that is to restore the ankle bone alignment and stability. And throughout the history of orthopedics, there's been, you know, all these different methods that are tried, and it seems like you have the bullseye, you know, with the center of the target is like really what we need to fix, and everybody else is just kind of treating everything around that. So what I invented was a little stent that we basically insert, well, not basically, we insert it into a naturally occurring space in between the ankle and heel bones. And instantly the ankle bone is realigned and the natural motion is restored.
Sounds so simple.
It is. It's one of the. It is a complex, simple surgery. So
it's 20 minutes long. It's minimally invasive. Yep. Who are the ideal candidates for this?
Well, you have to have flexible hind foot misalignment, and so we have great videos here that we show how their feet are aligned and then misaligned. And so when you can stand and basically realign your ankle bone and how your foot and ankle and lower leg are realigned, then that means you're a great candidate for this procedure. Unfortunately, there's so many people that have kind of just been trying all of the various conservative methods, and then their bones are to the point now where they're rigid or semi-flexible, and unfortunately at that time they may not be a candidate for the HyProCure procedure.
And how young of a patient you could be, and how old?
Yeah, so the age limits are usually, you know, 3 years is the bottom, and not that we say that every 3-year-old should have this, but by 3 years of age, the chamber becomes ossified. The oldest patient that I know that has had HyProCure put into their feet is 94 years old. So yeah, and you can even be long, you know, later, but just as long as they still have that flexible hind foot, you could be a candidate.
This is so exciting. I know we have some great testimonials from doctors and patients who have benefited from this, so let's toss these videos.
Exactly, absolutely.
I've had flat feet my entire life, and so I've always had feet pain, hip pain, knee pain, shin pain, all day long from whatever kind of shoes that I wear. And so learning about this procedure, it was an easy thing that I wanted to sign up for. And I said right away that this is something that I was interested in without hesitation. I always had this dream of having the perfect arches. And with this procedure, that is exactly what I found. I've been able to wear any kind of shoes now without any type of problems. And so that has been life-changing for someone who really enjoys shoes. I'm able to walk and run and move around quickly without having any type of discomfort. At first I was really hesitant because I was so used to having the discomfort, but now I realize that, you know, I can trust the arches that I have and trust my new feet to give me that freedom.
I had severe pain in my feet and my ankles, walking longer than an hour. It inhibited me doing any kind of long-term activity. I couldn't do any kind of walking for exercise. I had severe spasms in my back, and my knee started to turn inward, so I started to have pain in my right knee. At my age, you probably would expect that because I was born with this, and I never had corrective shoes or anything. I tried all kinds of over-the-counter orthotics and those kinds of things, but they helped a little bit, but they didn't really take the back pain away or anything like that. So, my foot is getting so much better now. It's really, I can tell that it's coming along, and I'm really excited to not have all this pain and be able to exercise and walk and bike and do whatever I want to do so that I can feel better. And I never related it to my flat feet. I never knew. And since I've had the right one done, just since then, my spasm is gone from my back, and my knee is starting to, I don't have any pain in my knee at this point in my right knee. It wasn't difficult at all. It was less painful than getting a filling in my tooth.
Doctor, folks want to learn more about this procedure or find a doctor in their area. I mean, what's a good source for them to turn to?
Well, we have a great website that's called atlasfai.com.
Very good. Well, we really appreciate your time and such great information. We're going to have you back more to talk more about this, these foot issues and get people back on their feet so they can have a healthy life.
Definitely. Love to. Thank you so much.